So this is just an update video, but also I thought I would give you some tips and tricks, that sort of thing, for dealing with various kinds of hand and arm injuries and surgery and so on. So if you haven't watched my previous videos, just over a month ago I had an ulnar nerve transposition on my right arm, and actually this is the brace that I have now. I've got to wear it at night still, but I can wear it off during the day, so I'm going to take it off just to show you what the scar is looking like. So at the moment, gosh, that light's bad. At the moment, this is what the scar looks like. Pretty long, but healing pretty well. This whole area of my elbow is numb, and this is quite sensitive to touch. So if I lean it on something, it hurts. If I bump it on something, it hurts. The nerve has been moved from where it would have been, which is right where the cut is, to the other side, so to just here, on this side here, and it is actually quite sensitive there. And as I talked about in my previous video, I did like slightly injure my other nerve, the median nerve, and it's still a bit sore, in there, a bit sore into my thumb and forefinger. Most of the pain from the ulnar nerve that was going into my fingers has now stopped, so that's pretty good. The main problem is movement. I still can't lift anything. Usually you get a 1 month period of waiting before you can start any lifting, but in my case, just because of the other nerve being involved and my history of complications, they've told me to wait 2 months. So I can't do anything at the gym, and my bending's still really restricted. I can only bend to there. Could probably push it just a tiny bit more. Yeah, so I can go almost straight now, but that, which you would think, oh, well, that's not too bad. It is quite frustrating when you can't touch your face or your head easily. As you can imagine, when you're, I don't know, eating, getting ready in the morning, putting a backpack on your back, anything like that, it is just a pain in the butt. So my left hand, because this is my dominant hand, my left hand is getting used to doing things that it never did before, like use chopsticks and cleaning my teeth and so on. If you watched my first video, you would have heard I've actually had 3 other surgeries on my wrists, 1 for trigger thumb and 2 separately for decurvatus tendinositis. I think that's how you say it. And so, and I had a complication with my trigger thumb, which meant that I had a hypersensitive nerve for a long period of time, excuse me, and couldn't use my my thumb properly. So here are some things that I have learned from having the last 2.5 years mostly defined by having hand, or in this case elbow, surgery. The first is, if you can, I assume if you had an injury, it's a bit harder, but if you can, if you've got planned surgery, it is really good to prepare in advance. Make sure you have everything you need at home. Like, make sure you have either someone to cook for you, or you've pre-made some meals. Imagine that everything's going to be just that little bit harder. With the hand surgeries, the main thing was that I couldn't grip, and that grip took a while to come back. With my elbow, it's the bending. And so there are a lot of things that take me substantially longer than they used to, and there are a lot of things that are extremely difficult. Now that I've had 2 things on my dominant arm, I would say my #1 tip is to get something like this. I'm not advertising for Colgate specifically, but an electric toothbrush is so handy. Trying to learn how to clean your teeth with your non-dominant hand and do that in a way that's satisfactory is really frustrating. So an electric toothbrush, I like this one because I can take it anywhere, and it's small and it's simple and it was cheap. but you know, if you want to get a fancy one, get a fancy one. The other things that have been extremely useful, what I would recommend to everyone is getting some of this stuff. It's medical grade silicone that you put on your scars once they're closed over. Don't put them on when your cut's open. And you can put it on for a few hours each day. Some people leave it on for longer. I find it gets a bit irritated if I leave it on for too long. And you can hold it in place with just some medical conforming bandage so it doesn't fall off. You can reuse this stuff and you can wash it, and it helps with scar healing. It's pretty amazing. They found out about it because of burns victims. They were using the silicone because it's really nice and gentle. They were using it on burns victims as just a medical dressing and realized that their scars were healing better. So this, they don't know exactly why it is, but maybe it's because of the way that it's stopping any air from getting into your scars. It helps your body heal the scars from the inside out. The other thing you should be doing with your scars is massaging. You can use straight sorbeline. I would do that at first. As my scars progress, I use Comfrey, this particular one, but you know, anyone's fine. And it's just a matter of actually massaging like into the scar. And when that's a fresh scar, that'll hurt. You just increase the pressure. They'll tell you to do that anyway, but it is so important to do that. This scar here that I'm massaging right now didn't heal very well, and it's part of the reasons why I'm having continuous problems from that. There are a ton of, you'll probably get some kind of brace made, but there are a ton of braces that you can use. In particular, if you've got ulnar nerve problems and you haven't had the surgery yet, most people recommend something like this. It's a straight brace to keep your arms straight at night. And if you can't keep your arms straight naturally, it does actually really help with the pain. So the brace is, I'm not gonna lie, it's kind of uncomfortable, but it works. It's got metal so in the inside, so it keeps it straight. I just got this off YouTube. I think you can get regular ones in you know, pharmacies and stuff. Sorry, I didn't get off YouTube. I got it off eBay. It was recommended off YouTube. For my wrists, I found this particular thing that my physio recommended to me was really handy. It's just called this little widget, and essentially all it does is fit over your wrist like this. Hard to put on when my hand's hurting. Just like that. And it just provides your wrist with a little bit of extra support as it's healing. My wrists are a little unstable, so as they're healing, they're really prone to getting like secondary sprains. And this is pretty low key. People don't tend to ask you what's wrong with your wrist, which is super annoying when it's consistent. So people don't tend to ask you that. It looks kind of like a weird bracelet. I find it very useful. I also use, you know, your regular kind of brace things at various points. A soft one as I was healing. In terms of pain relief, I used anti-inflammatories and some opiates when I was given them, but I also used good old Tiger Balm and also chemist's anti-inflammatory gel. Only thing to keep in mind with this one is that if you're also using anti-inflammatories internally, you are upping the load of anti-inflammatories. The other things that I don't have sitting here, but I do recommend are that you get a shower cap. It's super annoying to always have to wash your hair, particularly if you can only use your non-dominant hand. It is actually hard to do. Make sure you have a plastic bag ready to go to wash straight after surgery. You may need to get some assistance with that. And also I take some supplements. I take zinc and I take just a multivitamin and whatever else I need at the time, but mostly zinc to help with the healing. Of course, with anything like that, with any of the medical stuff, ask your doctor first before you use anything. But for me, that just helps my body heal itself. So that's what I use. I also keep up a high fiber diet, particularly if I'm using opiates. And make sure I get a lot of rest and do all the physio exercises they tell me. So if you've got an injury or you're having surgery soon, I hope it all goes well. And that's my update. Thank you. Have a look at the rest of my channel.